So, Dr. Kafuuma,
Yes.
one other myth is diagnostic costs and tests are very expensive. That for a couple to even come here, it is an abhorrent cost. Is that true or false?
False, but also it's relative, I think. Because if you fear to go to a hospital, trust me, these people will be doing something elsewhere. They will either be taking herbs, which are also not cheap. Trust me, herbal medicines are not cheap. They will either be going to see a herbalist or a spiritualist, or they will be doing they won't be sitting at home, so they will be doing something. And you realize that people waste a lot of time in things which do not help. They end up spending money, which in the long run turns out to be a lot. So by the time they decide to go to the to professionals, they've already wasted a lot.
So, doctor,
yeah,
when a couple comes to you, what do you look for initially? Yeah, because people think that when you come, you have to automatically pay for an expensive treatment, IVF straight away. But since you said there's other things that you do beforehand, what is it that you do to a couple? A man and his wife, for example.
So once it's very important for people to be going to hospitals as couples. I emphasize that it's good for you to go see a doctor as a couple. Reason: we've already seen that infertility can affect both sides, a man or a woman. So once we get this couple for the first time, of course we listen, we take history to try and find out where the problem could be. We take history regarding the menstrual cycle, whether your periods are regular, the flow of the blood, it's also important. Any other underlying disease condition. Yes, then we subject this couple under investigations. So we do a scan. The scan helps us to look at the uterus, to rule out any if there are fibroids. Then we look at the ovaries. So in the ovaries, we are trying to make sure there are no cysts. For people who are already in menopause, their ovaries appear in a certain way, or a young lady who has gone into premature ovarian failure, whereby periods have stopped. You find a lady 28 years, then they've not gotten a period in 5 years. So some of them have what is known as premature ovarian failure, whereby their ovaries are no longer producing eggs. So such ovaries have a certain look when we do a scan. So those are the things we pick out. Then we do the fallopian tube test, the HSG. Then we do a semen analysis for the husband. So once the results come out, we do hormonal tests also for the lady. Once the results come out, then we see which treatment to go for or to recommend.
But then, what if a couple comes in and they say, I know what's wrong with me, I want to do IVF. Does that make sense? Is that, because some people know, it's not me, it's her.
Yeah, by the time one says that I know what my problem is, maybe they've done an investigation somewhere.
Okay.
Yeah, so if they come certain, maybe their fallopian tubes are blocked.
But
they know what they want.
You encourage diagnostic testing.
Yeah, we can recommend one of the diagnostic testing or procedure that we do is laparoscopy, whereby if we think one's fallopian tubes are redeemable, then we can do a laparoscopy and try and correct the fallopian tubes, or check for any other cause of the infertility that they might be going through.
Thank you, doctor.